Her whole face was covered in these strange, thick growths, and doctors had no idea what they were. Some said cancer. Some said it would never be safe to touch. But one surgeon looked closer and saw something nobody else did. What happened next changed her life completely, and by the end of this video, you will not believe how she looks now. Okay, let's just look at this for a second. Nose, cheeks, lips, forehead. Almost nothing is untouched. Oh wow, this is heavy. When you see a case like this, your first instinct is fear, because your brain is trained to think the worst. Large growths like this, spreading across the face, covering the nose, pulling at the lips, that combination usually means something serious. But here's where it gets interesting, because not everything that looks frightening actually is. Now, if I had to guess just from looking at this, my first thought would be some kind of tumor cluster, maybe something aggressive, maybe something that keeps coming back no matter how many times you remove it. That's actually one of the scariest possibilities in a case like this, because some of these growths regrow after surgery, and some never do. And you can't always tell just by looking. You have to cut in, remove tissue, send it to the lab and wait. That waiting part, that's the suspenseful part nobody talks about. A surgeon can be standing right there with the mass in their hands and still not know for certain what they're dealing with. Now the real problem here isn't just how this looks. It's how it functions. See these growths pressing into the nostrils? That's not just a cosmetic issue, that's a breathing issue. Every single day, this person has been struggling just to get air in properly. So this isn't only about appearance anymore. This becomes about survival, about comfort, about basic quality of life. And that changes everything about how a surgeon has to approach it. You can't just think about making it look better. You have to think about function first, and look second, even though both matter deeply to the patient lying on that table. Now here's the part that keeps me up at night when I look at cases like this. Removing the mass, that's actually not the hardest part. Cutting it away is almost the easy part. The real challenge, the real skill, comes after. Because once you remove something this large, you're left with a defect, a gap, an area that needs to be rebuilt. And the question becomes, is there enough healthy skin left underneath to cover everything back up? Or has the growth destroyed too much of the normal tissue underneath it? If there's enough healthy skin, you're in luck. You can reconstruct, you can close things up, you can create something that looks close to normal again. But if there isn't enough, you're now talking about skin grafts, borrowed tissue from somewhere else on the body, and a much longer, much harder road to recovery. So as this surgery begins, nobody knows yet which version of this story we're going to get.